Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Get your mic. Good morning. Happy Valentine's Day almost.
Almost there. We can wait.
That's right. We can't wait.
Yeah.
Something you said to me when I was telling you about sometimes people are sad and maybe they've lost a spouse or they're in the middle of a divorce or there's something. And I said, what do you do about that? And what did you say to me?
Well, when you
your own Valentine.
Yeah, exactly.
Said.
You know, there are many of us we are going to spend Valentine by ourselves. We won't get a Valentine card. We won't get. We won't get roses. And but you know something? Look at the mirror. Just be your own Valentine. And I do that all the time. You know, sometimes during holidays, and I would be by myself or what have you. I go and give myself a gift and open it. I open my own gift, and I don't act surprised. I know what's inside. But I try to, give myself something and make myself happy. So there are many of us out there that feel that because, there are many out there that I'm happy for. They have a loved one. I have, I think right now in my staff, in my family of, AGI, we have one girl that is pregnant. Yesterday we found out that she's having a little girl.
Oh.
So I keep telling everybody her name is Victoria. I say, Victoria and we are having a little girl. So I'm going to be a grandpa again.
Yeah, see?
Yeah. So every time one of my staff have kids, I become another grandfather to another.
Well,
I say, well, as long as the alimony is not coming in, we're going to be A-okay. So there are people out there that have their babies, and there are people that will have their husband or boyfriend or girlfriend or ex, whatever, to be with. And, all best for them. But there are many people out there that will be by themselves. And there is nothing wrong with that. It's just how you handle, what the attitude that you take. What is your faith value? One of the things that I heard, listening to one of those, preacher go over, God's time. And the preacher was saying, I recall, that, things happen when God wants. And the problem with people is they can't wait. They want it when they want it. And if you have faith, things will happen when God decides, okay, it's time for you to have this or have this person or not be alone anymore. And, we tend to listen more to society. Oh, I'm turning 23. I don't have a boyfriend or a girlfriend. Or, I'm turning 27. I'm not pregnant. People go by society. You have to go by what does God wants for you. When is the right time for you to fulfill not only your wishes, but God's wishes?
But let's go to people who are, and a lot of our audience is 60, 70, 80, and
they can have a boyfriend.
Yeah, no, they can have a girlfriend too. We have some men, but the thing is,
I have one of my patients. She's 100, and her boyfriend is boyfriend is on the 80s.
Oh, yep.
She looks great.
That's
she
it.
looks really, really great.
Well, because love comes in a lot of forms. They comes in with someone going and having dinner with you and just being with you, holding your hand.
And something, and she goes, he keeps me going. And I ask her, because, you hear words, you hear phrases, but you don't understand it. He keeps me going. So I say, what does that mean to you? She goes, well, he's sick. I'm healthy. And I have to take care of him.
I love it. Well,
it's so cool.
It is. Yeah,
some people will say it's the other way around. If I'm hurt, and that's the problem. See, that's why some people are lonely, because they want things to be better than what they have. If I have money, I want people with more money than what I have. You know, if I have this, I want somebody with more than what I have or equal to what I have. So they start looking for material thing and not for true companionship, which is the first thing we should look for. You know, companionship, then friendship, then love.
I agree.
There's a lot of people that look for love and they don't care about friendship. They don't care about companionship. And that's kind of, you know, tricky. It's kind of a Russian roulette.
Yeah, that's not good. But I want to talk, just get a little bit deeper into this because I know that it's kind of fun.
Dig in, Richard. Go ahead.
But Dr. Mencia, when you think about people who are really sad and they're on medication because their doctor has told them that they're depressed and they'll feel better, and maybe the medication's not working, and maybe they don't know what to do about it. What should they do besides come see you? Because I know you're so good.
Yeah, there are two things. Well, you know, my background before becoming MD, I'm a psychologist by training. So I think that's a big plus. And a lot of patients like that. Say, you know, I know he's a psychologist and I know he will understand me and he will know what to do. And I love this radio show because of that. We can educate people. Now, we just have a very important person in the community that committed suicide. Very, you know, married with a beautiful wife, with a kid, and he just got a big promotion with the Health District. And why would somebody with everything moving forward commit suicide? And a lot of times, more than 80% of the people that commit suicide, that take their life, will let somebody know that they're going to do it. They let somebody know. Say, listen, I can't take it no more. When if it's you that are going to do this to yourself and you let me know and I do nothing about it, you're talking to the wrong person. You need to go to the next person and let another person know. So I tell my patient, let 12 people know. And after 12 people, then you find out you don't have any real friends.
Because
and then go to a hospital.
Maybe people don't really listen.
They
some
don't people listen,
do they?
You know, especially through people going through divorce. People going through divorce and people, you know, you see people going through stress. They let the spouse know, I can't take it. I'm going to kill myself. The spouse will sit back and let it happen. And
excuse me, what should the spouse do? Let's say that it doesn't. What
the spouse should talk to the person, go and keep the person company, especially if there are kids in the middle. Don't just sit back and let it be and wait to see. Let me see if he or she is dead by tomorrow. You know, if this had happened before, either the attempt, physical or verbal attempt, call somebody or go with somebody, call the doctor, do something to prevent a person from taking their life. You know, I think in my book, this person should be accused of homicide when that takes place.
If they hear and they don't do anything about it.
When they hear and say, well, you know, he told me that he was going to, or she told me that she was going to kill herself. And I knew about it, so I thought she was bluffing, and I let it be.
Yeah, that's hard for someone because some people, as you said, they want attention, or they think it'll get their spouse back.
Let me tell you a story about a positive story, because, you know, my show have to be positive. It have to be about happiness.
Yes.
Let me tell you a positive story about suicide. I had a nurse. She used to work at Holy Cross Hospital. And she fell in love with me because she saw me taking a patient that the therapist had not shown up for, to do physical therapy. She had a hip replacement or knee replacement. I don't remember which one. And I grabbed the patient. I said, come on, man, just grab the walker, call one of the nurses and tell her to help you walk. So I grabbed the walker and took my patient by supporting her back. And I said, okay, let's do some steps. Let's do some walking. And the nurse looked at that and she said, oh my God, I've never seen a doctor come to the hospital and walk with a patient, motivate the patient to walk. So she said, I want to be your patient. She became my patient. Long story short. And we went through everything. She she come one day and say, Dr. Mencia, I'm taking Prozac for depression, but it seems not to be working. So I went through the routine. Are you homicidal, suicidal? No. So, okay, let me give you this other medication that is going to be a booster because you already max out on Prozac. So let me give you this other medication. Being a psychologist and being an MD, what makes a difference between psychologists cannot prescribe, but a medical doctor can prescribe. So having that combination is almost like being a psychiatrist. I cannot call myself a psychiatrist because I don't have the training. But I said, let me give you a booster drug and see how you're doing. She lived by herself. Her mother lived nearby at that time. This was in the late 90s. Her mother lived nearby in the same community, and she lived by herself, and she called and she told the operator, I need to talk with Dr. Mencia, but tell him I need him personally to call me back. I don't want the assistant. I need him. So I got the message. So this is one of my nurses from Holy Cross. I called her back, and now we have a relationship because she likes me a lot. She respects me a lot. Yes. Yeah. So she called me and she said, Dr. Mencia, I lied to you during my visit. You asked me about homicidal and suicidal and, being a nurse, I know what you're talking about, but I lied to you. I really feel like killing myself. So then I said, okay, let's go through the next step. Do you have a plan? She said, yes. I own a gun. I loaded the gun. The gun is loaded. And I thought about using the gun, which is what the doctor did. They just committed suicide. He took the gun and shot himself. And she said, I own a gun. I said, will you do me a favor? She goes, yes. I say, listen, I'm not calling the cab. I can call the police and then we can break a leg to you. I'm not doing that. What I'm going to do, I'm going to close my practice. And if you wait for me, I'm coming over to your house. Can we do that? And she goes, yes. Okay. Where do you normally have the gun? On the safe deposit bag. Okay. Can you make sure the gun stays there until I get there? Yes. Will you promise that to me? Doctor, I would love to see you. It'd be an honor for me to see you before I go. I said, okay, cool. So I came over, sat down with my patient, explained to her what was going on being a nurse. I told her, usually when you are very depressed, when you are very down, and you are coming out of the depression, you thought about suicide when you came to see me, but you didn't have the energy. That's why you didn't even talk about it. Once you're coming out of that depression, now you have the energy to kill yourself. And that's what you're going through. Mm-hmm. So it's a normal process what you're going through, and we can fight it, and we can fight it together. So I'm taking the gun with me, and I never had a gun until those few weeks until she got better. I'm taking the gun with me home, and you is going to get on an ambulance. We're going to call the ambulance. We're not calling the cab. We're not Baker acting you. We're calling an ambulance, and we're taking you to the hospital. We took her to Imperial Point Medical Center, and we admitted her voluntarily, which means that now she can leave whenever she wants to. Where when you are Baker Act, you have to be let go by a judge. It goes in front of a judge. And then the judge decides if you are ready to go back to society or not. So we voluntarily admitted her, went through the treatment. I will go to the hospital and follow up with her and what have you.
Excuse me, I'd like to ask that. So what kind of a treatment would happen at a hospital if you're in depression?
It can go from medication adjustment, which is very, very common, all the way to shock in the brain, electric shock. People get the bad connotation when it comes to electric shock. Oh my God, but that's one of the best treatments. Get you out of depression in a day. Boom.
Why is that? What
because
your brain is...
because what you're doing when you shock the brain, you are putting the brain to like a seizure, like a convulsion. So all the chemical that the brain is lacking, the cell releases everything. And all of those chemicals are backward balanced because depression is nothing but a unbalance of chemical in the brain. Depression is the same thing like asthma. But we don't kill ourselves when we have an asthma attack. But when we have a lack of a imbalance in the brain, it will take us to suicide. It will take us to homicide, to kill our kids, to kill our loved one. And it's the depression. What society need to learn from this talk is that most people will give a warning to somebody else before they do it. Before they kill their family and kill themselves, before, they just kill themselves and don't touch anybody else, they usually give a warning to somebody. It could be to a priest, it could be to a doctor, it could be to a friend, it could be to an ex-wife, ex-husband. They'll tell somebody. And depression, suicide, for example, is not only because of depression. You can be so stressed in life. You can have so much stress in life. And when stress is paired with pride, for example, look at me. I had been so successful since when I started practicing here in South Florida. By 4 years, I think it was. I have 4 years in practice. I already have this big center that I have created. And my colleagues were saying, how do you do that? How do you do that? I would work 7 days a week, 24 hours, just making my dream come true. Become so successful. And you keep growing, And if you get to a point tomorrow that God decides to take everything away from me, when you have stress paired with pride, those people tend to kill themselves. But when you have stress paired with humbleness, then you say, it's okay. You might lose all your friends around you. All the people that are around you that you thought were your friend, that you thought they love you, they will, walk away. But that's okay. God will bring people to you that will be your true friend, that will love you for who you are now, even though you cannot dye your hair anymore and your gray is going to show. You cannot put on the beautiful mask to keep your skin smooth, but people still going to love you for who you are. The real people will come, not the fake that used to love the surface that they used to look at you. So I think, if we learn to be humble, and we are going under stress, most people commit suicide not because they are depressed, also because they are stressed out and they don't know how to call for help and give it up. So a lot of time we have to go through life and say, it's okay to give it up. It's okay to say this is too much for me. Another of the stressful situation people go through is that when we go and we open a business, a lot of us will go there and say, I'm going to open my own business. And it could be a hairdressing salon, it could be a medical office, it could be a medical center. You open your business, and in business, failure usually comes when we don't know to give in and say, this is the wrong path. I have to switch gear. So you have people out there that because of their pride and their ignorance on business, and a lot of doctors, we don't get taught anything about business. I learned about business because my father in Hawaii was a businessman. So I learned a lot of business from what I call street business. Street business. So in business, you have to learn to say, I took on this project to open a hair salon, but it's the wrong thing. It's time to give up. Let me go and do something else. Let me just go and work at another hair salon and just.
But that's where the pride that you were
talking about. That's where the
pride
comes in.
That you should be willing to do it if it's wrong, but it takes a certain amount of support.
Always.
It's a support system. And we talked about that. But before we go any further,
it's like quoting from Hillary Clinton. It takes a village to prevent a suicide.
Okay. Well, let me just tell everybody who you've been listening to. If you've listened for many, many years now, you know that Dr. Andy Mencia is one of the smartest and one of the kindest physicians probably in the world as far as I'm concerned. But if we live here in South Florida, he's very easily accessible. The name of what he started many years ago is now called AGI Medical and Dental Centers. It used to be Adult Geriatric Institute, but they now have expanded, and they're not only in Fort Lauderdale and Commercial Boulevard, they now are in Boynton Beach on Hagen Ranch Road. If you want to call, they're open on Saturdays. Both of the centers are. You can call 954-489-1345 in Fort Lauderdale. I'll repeat that slowly. 954-489-1345, or in Palm Beach County is 561-270-6494. 270-6494. And I hope you have had your flu shots. It's not too late.
It's not too late.
Go get your flu shots. And remember, if you are homebound, that they are one of the few organizations with expertise that will make home visits. I just wanted everyone to know that. And you go on their website, agifl.com. Why don't you continue with this Be Your Own Valentine, because it's really important. I think people are... There's a lot of sadness, especially with all the politics going on and all.
Right. And the way society have projected on us to develop our way of thinking. You know, way of thinking is influenced by our culture. And if you look at the way of thinking of the future generation, it's not what you and I know today. You and I way of thinking came from our immediate family and from the teacher that we used to have. Those are the people that influence us.
And
we have the internet now. Now you have the internet. You have a window that have opened up during our time, but it will influence the future generation a lot more. And before, just one generation, and maybe we are part of that. We are at the tail end of this generation, where the television became the babysitter. When television went color, all us in this room, we just probably used to go out and ride the bicycle, have our brother, our sister, our next door neighbor come with us and play games and do things like that. It was more of a human relationship. Then the color TV came in, and color television. I remember in Hawaii when we got our first color TV, we were like a movie theaters. We used to have the neighbor coming over and peek through the window. My father would try to close the window. My mother would go, "Don't be so greedy. Open the window. Let the people say we have color TV. Why is it bothering you? I want privacy." So it was interesting. But then eventually, color TV became the babysitter. Now we move into a new generation that we are also part of, and we are toward the tail end of it. And it's going to be in the computer age, and the value that we get. And look at ourselves. You know, I have one of my staff say, "Dr. Mencia, can you explain to me about venous insufficiency? Because I look it up on the internet, and I couldn't quite understand." So I become now second part. But if she would have gotten whatever information, good or bad, on venous insufficiency.
So you want me to refer to you as Dr. Google?
Dr. Google, right. So I asked her, "What did you learn?" She said, "Well, they say that, of course, the article she was reading was being promoted by this company. They sell support stacking. So they say, if you have venous insufficiency, your leg feel tired, just buy some support stacking and blah, blah, blah. And then you have the ad coming at the bottom."
Not a good idea without a doctor knowing.
So I asked her, "Did you buy it?" She goes, "Yeah." And it just so happened my sonographer is there. So let's do an ultrasound. So, of course, she said, "You want to do the venous?" I said, "No, I want to do the arterial." She's a heavy smoker. So she's a heavy smoker. She has a lot of arterial disease on the leg. I say, if you buy the support stacking, you have two problems. You have the venous insufficiency, but you also have arterial insufficiency, arterial stenosis in many places on those things. If you buy those support stockings, you will lose your leg. Oh, but I already bought them. I say, okay, give it to somebody else. It's a free gift now to somebody else, but it's not for you. So now we go through the internet, and we follow through the internet. You know, Valentine, what the internet is going to tell you. Go to the club because we want your money. Come to the club and we have dances and we have, we're going to find you a Valentine if you come to our this and our that.
Right.
You know, go to the synagogue, go to church, go to a group, just, you know, get out of the internet and keep that human relation part. The internet has a place. I love the internet. You know, there's a place for it and we can use it positively. But like many, many things in life, we have to remember it's a double edge.
But the internet does not give you flowers. And I think that you started off the show, I think that everybody should go, when they go to Publix, buy themselves a rose. Buy yourself a flower. You know, even I hesitate to buy the flower. I used to bring Bill flowers. He brought them to me. And I don't know, we're not doing it because we have these orchids at home. I'm going to start buying a rose.
I remember one Valentine, I was so happy with myself. I went to a florist. And I said, I want the most beautiful. Put the phone away. I went to a florist and I bought myself the most beautiful flower. I said, you know, because I felt so good about myself.
I think that's it. And I think that this has been a great show, Dr. Mencia, to talk about people. Be your own Valentine and make yourself happy, but make someone else happy, because then you'll make yourself happy.
Of course.
You make a lot of people happy all the time. So I'm going to remember on Valentine's Day to get you a flower.
Thank you.
It's been great. Thank you, Dr. Mencia, and we're going to be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.